Hi, this video is the demonstration of the FUT linear scar, and the scar is running from one ear to another ear, and the result varies from one individual to another. I try to produce as many examples as I can. Again, the result varies from one individual to another. Some patients have even better scar than this, and the scar is in some patients has worse scar than this, because sometimes even though the surgeon, we try to use the latest technology, the tricuspid closure, and but again, it's just sometimes it's out of the surgeon control, because some patient, their body produce better scar. It's just genetics. Some patient produce you know wider scar, and then sometimes because their body produce that sometime. Okay, again, I produce both FUE and FUT. Results vary from one individual to another. I try and show them as many examples as I can. The FUT is a linear scar. There's always pro and con for both. The FUT, the downside of FUT is a linear scar, and it's a little bit more invasive than the FUE. And they both are minimally invasive surgery. That's why we do outpatient and go home, and it's a little bit more painful than the FUE. Again, it's not that much painful. You can still have the control of pain medicine, but the benefit, on the other hand, of the FUT or the strip method is half price. It's a lot cheaper than the FUE. We can harvest bigger number of grafts per day. We start around 3,500 grafts and go all the way up to 6,000 grafts. So the FUT is better for advanced hair loss, and most patient, when they're given a choice with advanced hair loss, they want to start with the FUT, and they want to maximize the yield. And then the second surgery, they can start at either decide to do FUE or FUT. So the FUT benefit is half price, it's cheaper, and you can harvest bigger number of grafts, so it's more for advanced hair loss. And when you compare my result from FUT and FUE, now I will produce excellent density with FUE or FUT for both. However, if you compare my FUE to my FUT will have strip method will have better density, 10%, 5 to 10% better density than the FUE. On the other hand, the FUE has their benefit. It's less invasive, because we're not cutting it open, and the scar is harder to see. It's tiny dots, and you can shave your head shorter. Faster healing, less painful. All that is great. And again, no technique are perfect. On the downside, the FUE is we had to shave more than the FUT, so it take longer for the back to be normal. Versus the FUT, we shave a small area, we'll cut out what we shaved, then when you walk out, the long hair will hide everything. Where the FUE will have more aggressive shaving. The FUE costs more because it's more labor. The number of grafts we can do is less. We start around 2,250 grafts. And we can go up to 25 to 3,000 grafts per day. There are days I can go beyond 3,000, but we don't know until we do the surgery. And some depend on how easy it is to harvest out. And then the other downside is the percent of growth rate. Again, I produce excellent density with both FUE and FUT, but if you compare my FUE to my FUT, the FUE is around 5 to 10% less dense. So this is an example of the FUT, FUSS, or strip harvesting linear scar. Result vary from one individual to another. No techniques are perfect. There's always pro and con for both. Both surgery produce scar. And again, this is one example of the FUT linear scar of my work. Now, some patient can have better result than this, so even very faint scar. And some patient, the scar is wider. It's hard for us to predict sometimes. Thank you.